Hello and welcome to a new episode of Majlis podcast by Emirates Hospital Group. My name is Wael Berro and I'm a family medicine consultant. Today is a pleasure to have one of my very nice colleagues and very different topic. We're going to talk about dental work. We're going to talk about teeth. We're going to talk with Dr. Munmun. Dr. Munmun?
Hi, I'm Dr. Munmun Dutta. I'm the general and restorative dentist with Emirates Specialty Hospital. I'm practicing dentistry since 24 years and it's good to be here, Dr. Wael.
Pleasure to have you over, Dr. Munmun. And the talk is going to be very different. And I know it's a the way you described it, very controversial topic. We're going to talk about tooth extraction versus root canal. So what are the main differences? We'll start with basics. What are the differences between tooth extraction and the root canal treatment?
Well, before I answer this question, you need to understand the anatomy of tooth. The tooth is divided into three layers: the enamel, the dentine, and the pulp. So when the damage or the infection reaches the pulp, root canal is done to eliminate and remove this damaged or infected pulp, clean the canals, and seal it to prevent further infection. Whereas for extraction, we remove the whole tooth out because we cannot save it due to several factors like severe decay or advanced periodontal disease or even fracture, trauma to the teeth, etc. This is one of the difference. Then the recovery time for root canal treatment is shorter with mild discomfort. The tooth is restored, the function is restored, the bone height is restored, and the jaw integrity is maintained. Whereas for extraction, since the whole tooth is removed, so we will need to replace the tooth because adjacent tooth may move, and also we'll need to put some kind of an replacement to restore function and aesthetics. And also the recovery time could be longer, especially if it is a surgical extraction.
I see. Okay. Now, without kind of getting into the secret of your business, basically, but for me as a patient, let's say I have a toothache and I'm coming to the doctor, how would you decide? How would the dentist determine whether an extraction is needed or a root canal is needed, or maybe none?
Well, the dentist always prioritizes saving the tooth with the root canal. Extraction is always the last option. But then there are several factors to look over here, like the condition of the tooth, the overall long-term oral health goals by the patient, and also, of course, the cost factor. But generally, if the tooth is salvageable, we'll do the root canal treatment. But if it cannot be saved because of the irreparable damage, then we would prefer extraction. Then again, there are certain systemic factors which comes into play, like if the patient is diabetic or if he has got cardiac disease, then we would prefer to do a root canal treatment to avoid post-extraction complications. Likewise, if it's an immunocompromised patient, then we would prefer doing an extraction so as to avoid the multiple visits, and we're not sure whether the post-treatment care can be maintained. But anyways, the choice is basically tailored to unique patient conditions and overall the long-term oral health goals.
Absolutely, and that's very good way to say it, because also in my practice we always say there's no one size fits all. It has to be individualized, and
Absolutely,
I think that's really it.
Many
Every
factors.
person has different needs and different history. Now, I know you alluded very briefly about the factors that determine which option you do, but what about the long-term effects? So whether we compare tooth extraction versus a root canal, what can you tell us about the long-term complications?
If we prefer to do extraction, you mean?
Comparing one compared to the other.
Okay, see, when a tooth is extracted, then there is a missing tooth there. There is a missing space or a gap there. Now, this can affect in a variety of ways. Let's talk first about like chewing and digestion issues. Chewing difficulties will be there. Efficacy of chewing will be reduced. So that will lead to nutritional deficiencies and indigestion. Then let's talk about aesthetics and phonetics, because the tooth is gone. So loss of tooth and loss of bone can lead to premature aging and sunken face appearance. Likewise, even the phonetics get affected. The pronunciation, the clarity of speech, that can get affected. But one of the very important things over here is the jaw changes and the bite changes that happen after a tooth has been extracted. It can lead to headaches. Now, a tooth has been extracted, the adjacent tooth will move in that place, the contralateral tooth will come down, there will be bite changes, the misalignment of bite and jaw. This will put strain on your TMJ muscles, which can cause you headache. So it's all interconnected. then your cervical pain and neck pain. Jaw misalignment has often seen it has led to face posture changes. This leads to strain on your neck muscles. That can aggravate or precipitate your cervical issues and even spondylitis. Also, the TMJ is a very important joint present over here. So, a lot of TMJ issues have been related to misalignment, malalignment of tooth, can lead to chronic neck stiffness, like many other things like lockjaw, and it can also worsen your spondylitis issues. Apart from that, a missing tooth or tooth missing or aesthetic problems that the patient face, this can also lead to less confidence in the patient, social interaction, and also mental well-being. So the mental, dental, and medical, it's all connected. And of course, there is also this law of parallelism. I had read it somewhere, like the interpupillary line should be parallel to your bite line, should be parallel to your nipple line, should be parallel to your hip joint, should be parallel to your knees, should be parallel to your foot. Now imagine if something went wrong with your foot, right? And because of that, you will start to have backache. Likewise, we have this fixed maxilla over here, mandible is moving. Now the tooth got removed and the synchrony or the balance has been shifted. So that can contribute to your neck pain, to your headache and all that. So yes, if you have a patient who is having a chronic headache or a chronic neck ache, then I believe his dental evaluation is must.
So even if most of us don't like our dentist, we still have to see you because it's needed.
Yes,
okay.
There's no
very good.
There's no way you can avoid us.
So on the same note, of course, it differs from one dentist to another, and we always joke. And I know I've been your patient. I admit online here with the audience that I know you have soft hands. I know you're very good. But tell me, is the root canal painful? And how does the procedure differ and compare to a tooth extraction?
Thanks to the modern anesthetics, root canal is not painful. We do it under local anesthesia. There is just a bit mild of discomfort or soreness that the patient feels after the procedure, which can be tackled with over-the-counter painkillers. Likewise, even extraction is done under local anesthesia, and unless it is surgical extraction, the recovery time would be just a bit longer, and there can be complications like dry socket or swelling and all of this. But yeah, the healing time would be more required for extraction, and for both of the procedures we do use local anesthesia. So yeah, it's not painful.
And you mentioned earlier, you alluded you said cost is very important. And of course, cost is very important. It's not a cheap option, but it's important. Without going into, of course, specific details, but the cost associated with each treatment, and which one would you say is more cost effective on the long term?
Well, we saw that once the tooth is removed, it does impact your oral cavity. There can be pain, there can be bite changes and all of that. There can be neck stiffness, so many things that we just heard about. So cost factor, initial cost would be higher for an RCT. It depends upon the complexity of the treatment, the materials which is used, and the expertise. And this is the initial cost where the RCT a patient would feel is expensive. Extraction, the initial cost would be low unless it is a surgical extraction. But if you come to the main important point here, that the RCT restores the natural function of the tooth, so you would not need a replacement. But on a longer run, after the extraction, you would require a replacement. So that is an additional cost. You may require a crown, a bridge, or an RPD, whatever. So on a longer run, definitely extraction is more expensive. Fine. But then there are also insurance factors. Patient can be self-pay, patient can be having an insurance. Few insurances do not cover crowns and bridges, and most of them do not cover implants. So it is always better to save the tooth with an RCT. RCT is generally covered with insurances.
Fair enough. Now, I'm going to go back to, again, and something that you mentioned earlier, the impact of an extracted tooth on oral health and the best replacement options after an extraction.
The impact is this tooth has been extracted, so the gap has been created. So there will be more opportunity for food lodgement, for bacteria to accumulate, and which can further cause decay and gum problems. Yeah. Coming to replacement, there are few options which is available with the patient. Let's start with implants. That's the gold standard, as it replaces or mimics the natural tooth very well. It's a titanium post which is put on the bone and it acts as a root. On top of it, we put the crown, and the bone height is maintained, and if it is maintained well, it can be there for decades. This is the first option. Then let's come to bridges. If the adjacent tooth from where the tooth is missing, if they are healthy and they are present, then we can use them as a support and can put a bridge there, a false tooth there, taking the support of these two teeth. This will also maintain your bone height, will restore function and aesthetics. But you have to remember, we'll have to trim the adjacent tooth a bit. Then the last option that we have is dentures, the removable partial dentures or full dentures. Where multiple tooth is missing, we can prefer that. The cost is generally less than the implants and bridges, and one point to be noted is that it will not maintain the bone height. But yeah, cost factor definitely comes to play, it is lesser.
Okay, fair enough. And thank you very much for these elaborate and kind of very good answers. Thank you very much, Dr. Munmun. I was joking earlier, but we all know that a lot of people avoid going to the dentist for different reasons. Whether it's fear, whether it's time, whether kind of lack of awareness of the importance. And then I have a toothache, I'll take paracetamol, I'll take some painkillers, I live with it. Where do you put the impact of delaying treatment? So how does that affect my health if I delay seeking first dental expertise and then deciding whether if the dentist recommended the treatment and then I decide to delay it because I'm living with it for another 6 months. Yeah. How would that impact my health?
That's quite common anyways. Well, Dr. Wael, if I need to elaborately explain you the impact of delaying the dental treatment on your systemic health, it would take an entire new episode of podcast. So I'll see you again. But let's try to put it briefly.
Please.
Mouth is the gateway to your body. So any untreated dental infection or untreated tooth can contribute to or even exacerbate your present systemic conditions. Like just say chronic gum diseases that can elicit inflammation, which can trigger cardiovascular disease, diabetes, or even rheumatoid arthritis. Periodontal diseases has been known to contribute or is responsible for atherosclerosis. Gum diseases have been known to be responsible for plaque accumulation in arteries. Let's talk about diabetes. Now this is like a circle. Poor sugar control leads to gum diseases. The inflammation in the gum diseases, they make it difficult for the sugar to be controlled. So you try eliminating the oral infections from your patient's mouth and see the diabetes improve. Likewise, the bacteria can be inhaled from your gum diseases and it can be aspirated to your lungs, can lead to pneumonia, or even it can contribute to asthmatic symptoms. Then the gum diseases have shown to have a link with preterm birth and low birth weight. The inflammatory response from the periodontal diseases has shown to influence pregnancy outcomes. Also, there has been certain studies which indicate a link between the bacteria which is present in the periodontal disease to Alzheimer's disease. And we also know that a missing tooth, it influences digestion. So this oral microbiome affects your gut microbiome. And it also impacts certain diseases like inflammatory bowel syndrome, inflammatory bowel disease, irritable bowel syndrome. So this is all connected. Right, apart from this, as I told you even before, it impacts the social well-being of the patient, his interaction, it can also lead to anxiety and depression, which is very common. So it's definitely related, interrelated, your dental health to your mental well-being and medically to your systemic conditions.
Thank you very much. That's very interesting, actually. And this is kind of the foundation of the 360 approach to wellness, because we cannot focus on one thing and it's not just black or white.
Yes.
It's a full spectrum of colors. And it was a joy, Dr. Munmun, to have you over. Sadly, this brings us to the end of our episode. Any take-home message you want to give to our audience today?
Dentistry is not a luxury. It is a necessity. It's not a byproduct of medicine. It's a parallel product. It's very important for your well-being. Now, to live, you need to eat. To get nutrition from what you eat, you need to chew. To chew, you need your teeth. And to maintain your teeth, you need your dentist. So please remember, you need your dentist to live. Most importantly, do not go by hearsay or Google. Visit your dentist once a year, if not once in 6 months. And remember to smile. It's your signature accessory.
So this brings us to the end of our episode today. Thank you for listening, and please stay tuned for a new episode of Al-Majlis podcast by Emirates Hospital Group very soon. Thank you very much, Dr. Munmun.
Thank you, Dr. Wael. It's a pleasure being here.